So my name's Molly McFawn. I'm the 4-H educator for Orange and Washington counties, and I'm here with Kimberly Griffin, the 4-H educator for Bennington and Rutland counties. And Jesse Carpenter and Michelle LaFrancis are also here with us while we welcome today's guest, Erika Bruner. While we're waiting I just want to go over the social code. So we ask that everyone's muted unless they're talking. We want you to share thoughts and ask your questions via the chat. So please stay on topic in the chat, but feel free to go ahead and type questions in there as we're going along. And there'll be a chance for you to ask Erika questions at the end as well. We ask that you're courteous and respectful. Make sure that you don't create any big distractions with where you're at. And if possible, you can keep your video on. That's great because then we've got people that we can see that we're talking to. And just stay engaged and participate fully because this is really for you guys. It's informational interviewing. And so informational interviewing is when you get the opportunity to ask a professional in the field that you're interested in what it's like, what day-to-day is like, what sorts of things, where do you go to school? There's all sorts of questions that you can ask Erika today, who's made herself available to us, which is great. So without further ado, I would like to introduce today's guest, Dr. Erika Bruner. She's a veterinarian and veterinary acupuncturist. Hi, Erika.
Hey.
I'd love it if you take just a moment and introduce yourself to us. Just tell us a little bit about your path and how you got here. And if you have any questions or anything, folks, feel free to type them right into the chat.
So my name is Erika Bruner. I live in Berlin, Vermont. I have worked in Vermont as a veterinarian since 2002. Do you want me to go through like the whole path of my career, or are we going to cover that when we have the visuals for that? Should I just give a little thing?
Yeah, I think just give a little thing, and then we're lucky enough that Erika videoed a patient with us so that we'll be able to see what it is that she does. So yeah, just sort of the thumbnail sketch, and then we'll ask more questions afterwards.
Sure, great. So I didn't know from the beginning that I wanted to go to veterinary school, but I eventually ended up there, and we'll probably talk about how I got there and how you guys could get there too, if that's what you want. And when I graduated, I worked first in a mixed practice in southwestern New Hampshire near Keene. So I did a lot of dairy work there and also a bunch of different domestic kind of farm animals and dogs and cats. And then when I came to the Montpelier area in 2002, I came to work in a small animal clinic. So that was dogs and cats and very occasionally an exotic like a guinea pig or a rabbit or something. We call those exotics or smaller mammals. And I left the clinic setting where I did general practice and surgery with the small animals after about 11 years. I started a solo house call practice. Again, with small animals. And then in 2017, after getting certified in veterinary acupuncture, I narrowed my focus to veterinary acupuncture and end-of-life care. So I still do the house calls for end-of-life care, but the acupuncture is mostly done in my office, which is just a little space. It's not a vet clinic. It's just a small space where I do acupuncture. So that's nice, actually, because it's less alarming or threatening to pets than to have to come to a clinic. And I guess that's a good segue to get into the video because the video was taken in my office and it shows me doing a treatment on Boris, who is a poodle, and he's one of my patients. And so we can watch that and then I guess get to your questions. So this is Boris, and he is about 12 years old, I think. And he is an older dog with some arthritis and some hind end instability. So one of the first things that I'll do when I have the patient come in is do a quick physical check to see if they have any areas of pain along their spine. Here he's kind of sinking down. That could be pain, or it just could be some weakness in his hind end, which we already know he has. Another thing that I'll do is check the range of motion of their hips and their knees, which we call the Stifles in veterinary medicine, just to see how that's going. And also squeezing along their bones and muscles to see if they have any pain in those spots. On this right side, he's a little reactive, so he's a little sore there. And then also the shoulders. He should be able to stick his front leg all the way out, so he's a little restricted in shoulder motion. He's okay in the flexion, the elbow, and the wrist. The wrist is a little restricted also. It should be able to fold further down. This is very common in older animals, just to have stiffer joints than younger animals. Sometimes that means there's pain there, sometimes not. Boris. Okay, so now I'm just gonna put a few needles in. Hi, Boris. Oh, little boy. So I use my mouth to hold the needles, and then I use my right pointer finger to palpate the point, and my left hand, because I'm a lefty, to put the needle in. So this point is called Bai Hui. It's in Chinese 100 meetings, and it's on the top of our heads, between our ear canals, and it's a very powerful point for calming, and also a point where many different channels meet. So it's one of the common ones that I use in the beginning of a treatment. And there's a meridian that runs straight down the midline of the dog. So there's a couple of points on here that are helpful for the spine. Every point has many different functions and purposes. Some of them are locally important. I would say they're all locally important, actually, as well as having other functions. You know, this point is on the stomach meridian. It's his knee, but it's the stomach meridian. And it's a point that helps with energy, which in Chinese is called qi. It's also a point that can help us with nausea. That's not why I'm using it for him. I'm using it partly for energy and partly as a local point for knee comfort. Some of the points have developed these sort of nicknames in Western medicine, or like, you know, with Western users of acupuncture. So here's a point on the ankle area. On us, it'd be right behind our ankle bump. Same with them. Here's his ankle bump, and here's the point. And it's on the bladder meridian. It's bladder 60. And in Western medicine, or like Western users of acupuncture, veterinary medicine, we often call this the aspirin point or the pain point. It has actions locally, but also kind of globally to reduce pain. So I've been using 1-inch needles because those areas that I've been putting them in have more kind of tissue underneath them, but sometimes I'll use 1/2-inch needles, which these are. They're just half as short. Oop. For areas that don't have a lot of tissue, like on the feet. So this point is on the stomach meridian also. This is stomach 41. It's right in the middle of the ankle, like on a person. It would be right here. And this is important for the connection of the feet to the ground. Like, it helps with stability in walking. So I usually put, they're symmetrical, you know, they're in the same place on both sides of the body. And I usually put both in, unless there's a reason I can't. Sometimes I have a patient that has to lie down, can't get up, and it's really uncomfortable for them to be up for any period of time. So then I'll just use the points that I can reach on the side that is up. So what else do we want for Boris today? Stay right there, mister. So in Chinese medicine terms, pain and stagnation, they're not interchangeable, but pain is a sign of stagnation. And when things aren't moving properly, that's when we have stagnation. And one of the big stagnation moving points is in the foot, on the liver meridian. So I'm going to put that one in for him. It's a tricky one to place because it goes between bones of the foot. On the top of the foot, you can feel the bones there above your toes. And this point actually is between the bones, the most inner bone and the next bone over. So it's hard to get that in properly sometimes, but also kind of uncomfy a little bit. However, Boris is a very tolerant patient, so he lets me do that. So that's the treatment that I'm going to do today for him. And now we just wait for about 30 minutes. His needles stay in, and I have chosen needles that tend to stay in even if my patient roams around. This is a pretty small space on purpose because I don't want him roaming too far, but he does tend to kind of wander a little bit before he finally sits down and takes a rest. So thanks for watching.
Does anybody have any questions for Erika about what they saw in that video? I've myself had never watched veterinary acupuncture before, so it was really interesting to me.
Most of my patients, but sometimes I see younger animals. I have a cat patient right now who has hydrocephalus. So that's a condition where the fluid that moves through his central nervous system doesn't move properly. And so it builds up and that puts pressure on the brain. So he's a young guy. I think he's about 5 years old. And then I have also seen younger animals primarily for injuries, either orthopedic injuries like, a cranial cruciate ligament tear in their knee, or I saw a beagle recently. He was 8, so it's kind of like borderline. He's not ancient. I mean, I would say at least 80% to 90% of my patients are just like super old, creaky dogs, because that's kind of where my heart is. But this guy, he was 8 and not creaky at all, and he had been run over by a 4-wheeler. So when I saw him, he couldn't walk. He was just dragging himself around, and I am actually working on a short video right now that shows his progress, but he's doing amazing now. You would never even know that he had been injured, but it was a long road. It took several months and a lot of work by the owners with physical therapy, but he did really, really well. I chose Boris because I knew that the video wasn't going to be a lot of me chasing him around the room, which is what some treatments are like. I will often look at an animal outside of my office because right now with COVID, I'm not letting people come into my office for the treatments. So I meet the people outside and we talk about their pet out there. So if it's a dog, I can just do the range of motion exam out in the parking lot and have the person hold them for me. If I was a normal vet, I would have an assistant and they would hold them for me. But when I don't, if I'm in the room and it's just me, I just do the best I can. I started learning how to do the best I could in veterinary school because, for example, when we're on the small animal medicine rotation and we have 5 animals to examine before we do rounds at 7 o'clock. So you have to get there in time to do your exam. And guess what? Everyone else on the rotation is trying to examine all their animals. So even though there are staff in the small animal hospital, they're busy doing other things. There's no one to help you hold the animal. So you kind of learn how to hang on to somebody and work with them all by yourself at the same time. And this is a very valuable skill. But, the best thing is to have an assistant who is helpful. Like the most invaluable thing to us in the whole world in the veterinary profession is our technicians who are better than we are at so many things, and who restraint is really a very specialized art. Like it's something that you learn by practicing. You can be taught things about how to restrain animals, but it takes years to learn how to do a good job. And I can't say enough about how important technicians are for us to do that. So I hope that answered your question. Well, for me, in my practice, the smallest animals that I work with right now, I have a Chihuahua patient, and he is pretty small. He's even smaller than a cat. So I just use smaller needles with him, and the points are closer together. I would say it's more challenging to locate points the smaller somebody is, the smaller their anatomy is. So my standard size needles are 1 inch and a 1/2 inch. And so, the 1 inch needles are about this long, and the needle part, like there's a handle that's the same size on all of them that's about 1/2 inch to 1 inch long. And then there's the needle part itself, like what is going to actually get stuck into the animal. So for a dog like Boris in the video, I used 1 inch needles. So the needle part is about that long on that. And then for the Chihuahua, I use, depending on where the point is, if it's a point where there's a lot of muscle, I'll use a 1/2 inch needle because I know I can put that in all the way. And then there are these teeny tiny needles called hand needles. And the needle part on that is like only about, you can't even see it, like this big. It's like, less than a 1/4 inch, I would say. So I pick those for really small critters, or for points, like especially points on the feet. There's not a lot of flesh on the feet, for lack of a better word. So there isn't a lot of tissue for a needle to stick into. So if I tried to stick a 1 inch needle into a foot, it would just flop over because most of it wouldn't be in the actual critter. But the really super short hand needles, which are made for humans, but they work really well for small critters and for points on animals that don't have a lot of muscle, just like our fingers. That's what those needles are made for, is to use points on the fingers for people. And then for horses, quite often the needles are really long, like they'll use a 3 or a 4-inch needle for a horse. And to do that, you can't just stick a 4-inch needle in because it's super thin and bendy. So you actually have a plastic guide tube. And so you put the needle in the tube, and then you put the end of the tube on the acupuncture point, and then you tap the needle handle and it goes in a little bit. And then you take, it's actually a guide tube in pieces. So you take off 1 inch of it, and then you put the needle in 1 more inch, and then you take off another inch of guide tube and put the needle in another inch. So I have never done acupuncture on horses. I've seen it done. But the program that I did was a small animal program. And so we didn't do any horse work. And I personally have avoided horses, not because I don't like them. I think they're really cool, but because I was never a horse person. I didn't have horse experience outside of working with them in veterinary school. And so I feel like horses, especially, you really have to be comfortable with horses. You have to be experienced in understanding how they think, how they send their little behavior signals to you, how to respond to them. They're among the most sensitive animals and also among the most potentially dangerous animals. And so, I've just never really felt comfortable working with them. But there actually is an equine acupuncturist in our area. I think she's still in our area in East Montpelier. Her name is Jen Bevilacqua, and her practice is called the Integrated Equine. So haven't talked to her in a while, but she is out there doing it. Not. It's possible to do acupuncture on pretty much anyone, like even turtles whose body is mostly covered with a shell. There are a lot of points actually on, from the knee down and the elbow down on a person. And those are joints that are fairly accessible on turtles. And so you really can transfer your acupuncture knowledge to any species, but I have yet to be asked to do any acupuncture on anybody other than a dog or a cat. Yeah, well, I mean, it's common. Like, in vet school, I had friends who were challenged getting through the surgery rotation, which was our first opportunity to actually do surgery. You just kind of learn to deal with it, I think. When I worked in the clinic, we had a lot of kids come through at doing externships and shadowing with us. And many times there'd be someone in the surgery room with me doing surgery. And I don't know what it is, like teenagers seem to faint more readily maybe than older people. I don't know, it's something physiological, but I was always sure to tell people like, okay, so if you're feeling faint or weird, don't be shy about it. Sit down, put your head between your knees, like look away, the feeling will pass. So I never had, well, one dude fell, but he was, he was just like, he was our kennel guy. Like he was an employee, and he all of a sudden just went from like standing to like a dead faint on the floor. But everybody else sat down first, put their head down, and kind of got through it. And I guess, I think that it is possible to get through. Like, I don't know how you get through it, because it was not a problem for me, but I have had friends who even made it to vet school and still had issues with feeling squeamish about things. And I guess it's just continued exposure, and over time you get used to it, and maybe it's a gradual process, like starting out with, I think it would be hard. I mean, I've had clients who are phobic about needles, and they just leave the room. If a person has a needle phobia from the get-go, like a really serious needle phobia, it might take some professional help to get through that. But I've never met anyone in this path who needed to do more than just to kind of practice and get used to it over time. And I think the important thing there is just to not try to tough it out, because if you feel faint and weird, you should definitely sit down and put your head down, because it's no fun to faint from standing or sitting, for sure. And it's also like, I didn't feel any judgment when I would see that happen. Like, it's just a thing that can happen. And it didn't say to me, oh, this person can't hack it, or they're a wimp, so plenty of people have had to deal with it.
All right. Well, why don't we start out? Should we put the graphic up now? We can start with that part of it. Do you want to go over it, Erika? Do you want me to ask you questions through it? What do you think would work best?
I think it would be good if you asked me questions.
Okay, there's a graphic that we have that will help people see sort of like a little roadmap on how it is that you can get to be a vet. So this is the typical route of a veterinarian. And Erika, can you tell us a little bit about what do you think folks in high school should be focusing on?
Yeah, so if you are in the position of currently knowing that you want to be a veterinarian, then it's important to do basically the same kind of things that you would do if you wanted to be a physician. And that is to really focus on getting your science and math classes. And I think that guidance counselors at school, or people who help you choose your classes, would have probably a better grip on what exactly to do at your school. But I often do like a presentation for kids at the Humane Society that are, maybe like between 7 and 12 years old. And they are often surprised to hear how important science and math are. It's really, that's what all the prerequisites for going to vet school are. And then once you're in vet school, you use that science, probably not so much the math, but you use a lot of the science background to help you understand what's going on in those first year classes, because in veterinary school, you have, the first year is things like anatomy, physiology, pharmacology. So they're talking about different kinds of chemical compounds and what are their activities in the body. And so it all builds, but starting out really early with science and math is super important. And then there are opportunities during high school and during the summer to shadow with a veterinarian, to spend the day or even a week, with somebody, just watching them do what they do. That's really useful, because when I did that, it helped me know that I actually wanted to be a veterinarian. There are these exploration programs. Many vet schools have them. Some of them are probably not now with COVID, but under normal circumstances would be residential programs. I'm sure that they're working to figure out how to get these things to work online. And they really give you a very kind of broad impression of what the whole field of veterinary medicine looks like. So it's not just being, a family vet for the dogs, the cats, or horses, or being a food animal vet. There's also lots of jobs in the military. There's jobs in industry. I have a friend who works for U.S. Fish and Wildlife who She's technically a veterinarian. She got a veterinary degree, but what she does is almost nothing about veterinary medicine. But her, what she learned in vet school enabled her to go into the field of, she really works in epidemiology in emerging countries. And, there's some aspect of how animal health intersects with human health that she works on, but it's mostly not that. It's about policy. So those exploration camps help you know more about that. And then in college, most people do the full 4 years of college, but it is possible to leave college after 3 years to go to veterinary school. And in college, you would be taking all the prerequisites for veterinary school. So that's typically a full year of biology with lab, 2 full years of chemistry with lab, a year of physics with lab, and then those are kind of the basics. Often calculus is required. One vet school at least requires a public speaking course at the college level. Biostatistics. When I went to Tufts and applied to Tufts, we had to have certain science electives. So that biostatistics was one of the things that I took, but other vet schools, it's mandatory to have that. So that does take up a lot of time. It's basically the same as a pre-med program in college, because the first year of veterinary school is very much like the first year of human medical school. In fact, in some places, the human medical students and the veterinary students are together in some classes. So there are combined college and vet school programs that you apply to the program before you go to college. It's like when you're doing your college applications as a high school student, you can apply to this program, and once you get in, you are in for the full thing. So they have one at Worcester Polytech and Tufts University. So the 3 years are at Worcester Polytech, and that's your undergraduate time. And then after you do that 3-year program at Worcester, you go to Tufts Vet School for the 4-year vet school program, and you just come in with everybody else into the vet school class, but you don't have to apply to vet school separately to do that. So I'm sure that there are other things like that elsewhere in the country, but that's the one that I know about because it relates to Tufts where I went. So once you get done with the college part, then you have the vet school part. And it's very much, like I said, like human medical school. So the first 3 years approximately are doing classes, and it's just tons and tons of sitting in lectures, memorizing stuff, taking multiple choice exams, having labs. Like anatomy lab is huge in first year, and you dissect a dog the first half of the year, and then you'd have a horse the second half of the year. And while you're doing the dog, you also work on a cat. But dog and cat anatomy are very similar, as opposed to horse anatomy, which is pretty different. So we had a whole separate horse. And then while we were doing the horse, we learned about cows, and they would bring in little parts of cows to show us, how's the anatomy different in cows, and lots of studying, just like nothing in your life but studying pretty much, and taking tests. Like the schedule, some classes in the first year are really big and really long, like physiology, where you learn about all the different organs and how they work together. It is a class that takes the entire year, and that you're in at least 5 to 10 hours a week. And then there's other classes that are really short. Like we had a nutrition class first year, and it was, maybe 1 or 2 hours a day for like 3 weeks. So every day is different, and every day you're in class from 8 to 5, usually with a 1-hour break for lunch. And then you go home and you kind of like try to wring your brain out, and then you try to stuff some more stuff in there. Like I was usually studying until about 10 o'clock at night or 11 o'clock at night. So it's pretty intense. But finally, you get to the part where you have been waiting all those years to get to, which is the clinical rotations. So the last year and a half of vet school, you don't get a summer off. Instead, you're going through rotations, and you rotate through all the departments in the teaching hospital: large animal medicine, large animal surgery, small animal medicine, small animal surgery. You can do electives. So I did one in dentistry with a veterinary dentist. You go off-site to do things at different locations depending on what's of interest to you. So I spent, at that time, was really interested in dairy cows. So I spent 6 weeks at an all dairy 14 doctor bovine practice in the Central Valley in California. I spent a week at Berkeley Dog and Cat Hospital, which is a really well-known small animal hospital in Berkeley, California. And they have a guy on staff there who just does reptiles and amphibians. So I spent a lot of time with him just because I thought that was cool and interesting. So there's a spay clinic for a week on Virgin Gorda, which everyone wants to go to because everyone wants to go to Virgin Gorda. And you just basically spay and neuter kind of stray animals of the island all day long for a week. So you get a lot of surgical experience there. So, the clinical year is very intense, but in a completely different way from the 3 years before that you spent with your face in a book. And then they turn you loose. Like all of a sudden you realize when you're about 2 months from graduation, like, holy crap, I'm going to be a doctor in 2 months. Is some magical thing going to come like from the heavens and fill my head with all this knowledge that I currently am so aware that I lack? But they let you out and you go graduate. And then depending on what you want to do, you could do an internship. They're getting more and more popular. There are more and more internship programs. At the time that I graduated 20 years ago, I think maybe like 10 to 15% of graduating veterinarians went to do an internship. So that's a 1-year program that's all clinical, that's supervised by advanced clinicians where you choose either large or small animal and you get just a lot more experience in dealing with maybe more complicated cases because they're usually in referral type hospitals that see more complicated cases, either in large animal or small animal. And it's combined medicine and surgery. And then after you do the internship, if you really want to be a specialized veterinarian and be an ophthalmologist, which is an eye doctor, or an oncologist, which is a cancer doctor, or a cardiologist, a heart doctor, then you can apply for a residency. And there are very few of them and very selective. And once you finish that program, which depending on the residency might be 3 to 5 years, then you have to be certified by the board, the college so-called, although it's really like a group of people, not a college that you go to, but they have requirements for board certification. And once you pass all those qualifications and exams and requirements, then you are allowed to call yourself a surgeon. Like, you can't say you're a surgeon in veterinary medicine unless you're actually board certified by the American College of Veterinary Surgery. So that's kind of the rundown on the whole extent of training. My daughter is 14, and just the other day she was like, wait, so you went to 4 years of college and then you went to 4 years of vet school? That's a lot of school. I was like, yeah, it is. But, some people want to go on and do 4 more years of training after that. In human medicine, of course, everybody does an internship. And I'm pretty sure that everybody who wants to actually practice medicine does a residency. And then after that, some of them have fellowships. So you can be in training as a doctor for years and years and years. In veterinary medicine, there's not as much specialization and there's not as much money in the whole field. And so few people actually become board certified. Like, if you know anything about how small animal medicine works in the state of Vermont, we at this point have within the state, I would say probably no more than 10 specialists, most of whom are either internal medicine specialists or surgeons. We do not have, for example, a dermatologist, which is a skin doctor full-time in Vermont. We have a traveling dermatologist who comes 1 week a month. So there's just a lot less specialty in veterinary medicine than there is in human medicine. So do you guys, before we go on to the MyPath version of the picture, do you guys have questions about applying to vet school, getting into vet school? What do you do there? Like the academic parts of things? Less schooling to be a vet tech. I don't know exactly what it is, but I believe it might be either a 2-year or a 4-year program after high school. I think you might have the option to do either a 2-year or a 4-year program in veterinary technology. And so if you did a 2-year program, you'd have an associate's degree. And if you did a 4-year program, you'd have a bachelor's degree. And there is a certification exam to become a certified veterinary technician, and I believe that's a national exam that's administered by the Veterinary Technology Certifying Board. I don't know the name of them, but it's a pretty different path. Sometimes people go to vet tech school with the thought that ultimately they might go on to veterinary school. I think that's a overly indirect route, and it's a really expensive route to go. There was one person in my class who had gone to technician school and been a technician before she went to veterinary school. But I think for most people, it's not really useful to do that. Like, you're not more likely to get into veterinary school if you already went to technician school. It's sort of a different, separate path. Unfortunately, technicians don't make a whole lot of money. So, you know, it's a job that people do out of dedication. Not that veterinarians make a whole ton of money either, but they definitely make more than technicians do. So the debt load coming out of veterinary school is higher than coming out of technician school. But I think your ability to pay it back is actually probably better as a veterinarian, even though you'd probably have more money to pay back because your earning power overall is going to be higher. But it's a big issue. Some people graduate from vet school these days with $200,000 and $300,000 worth of debt, and it is very, very hard to pay that back. It takes a long time for a lot of people. It's not going to change how long you would go to school. Different schools handle that differently. When I went to Tufts, there wasn't any tracking, so all of us got the same education. We all spent the same amount of time studying the same stuff all the way through the academic part of veterinary school. And then where we got our different experience and education was in the hands-on clinical part, which was the last year and a half. So I did a lot of bovine stuff because I hadn't had any experience there. And then I also did otherwise mostly small animal stuff. And there was some required time with horses. Large animal medicine and surgery was like 99% horses. And so even though I didn't intend to do much horse work, we all had to do that. But UPenn, for example, does have tracking. And so they have, when you start, you're like, okay, I'm going to be a small animal practitioner or a large animal practitioner, or you can choose the mixed track that does both. I don't know how things are now in veterinary school because it's been 20 years since I got out, but I would be willing to bet you that it's still probably the same, that some schools do have a straight curriculum that everyone does, and other schools have tracking. I would say that it's unlikely that there's going to be an exotics track specifically, just because that's such a small field in veterinary medicine. But there is, for example, an exotics internship at Tufts and a residency. So it is possible to become very kind of highly trained in exotics, but it's also possible to just go to regular old vet school, do the same curriculum that everyone else does, get your exotics experience during your elective time and during your clinical rotations. You know, you'd be reading up extra stuff about them. So with your personal experience that you have, that's invaluable because you've got a head start. You actually know how to take care of some pretty challenging animals. You know, it's a lot easier to take care of dogs and cats than it is to take care of reptiles. And so your experience there is really useful, and you would build on that through vet school, but it would take the same amount of time to go. And maybe we could put up the graphic of my journey, and then I could talk about that, and I will answer your question while I am talking about that. All right. So I, unlike many, was not one of those kids that always wanted to be a veterinarian. I always loved animals, but I wanted to be an architect from the age of 9, and that was my plan. And so in high school, I was taking more like physics and math. I wasn't really thinking about chemistry and biology so much. And I did a lot of extracurricular stuff there. The Boy Scouts have an explorers program for different careers. And so I did that, which was really useful. And in college, I went to a kind of general liberal arts college, and I majored in something called the growth and structure of cities, which was urban planning theory and architectural history. At least that's what I chose to focus on in cities. And I still wanted to be an architect until finally I actually got the opportunity to do a study abroad program. And a big part of that program was design studio, where I actually was able to design a building for the first time. And that experience made me realize that I didn't want to go to architecture school and I didn't want to be an architect, but I still really, really liked buildings. And so I continued the cities major and I wanted to go into historic preservation, which is preserving old buildings. And then I graduated and got a really great job, the assistant director at the City of Cambridge Historical Commission. And I think about 2 or 3 years into that, I realized that I was never going to get my boss's job, which was the job that I would have wanted. And that there, in this whole state of Massachusetts that has 350 cities and towns, there are 6 with paid staff for their historical commissions. And there are 2, Boston and Cambridge, that have full-time staff, any. So it's like, there's no room for me to be anywhere in this field. And I still really think old buildings are cool, but I need to do something that's like hands-on. And I also felt like I needed to do something that was more immediate. Like I needed people to need me to do something like right now, because when something would come into the office and it was just this stack of papers and it was sitting there and I was supposed to go through it and catalog it. Oh, it's just the most boring thing you could think of. I did not want to do that job. Did not want to be an archivist. So, I looked around and thought, well, what will I do? I like animals. Maybe I could be a veterinarian. So I thought about 3 or 4 other things. And in the process of thinking about them, I spent time with people who did these different jobs to find out what they are like. And after hanging out with several different veterinarians, I thought, hey, this is pretty cool. I think I do want to do this. Like, it's a job where you need to learn your life long and it's really complicated and you have to be smart, but it's also very immediate. You have to work with your hands. You have to be able to work well with other people and you get to work with animals. So I did not have pretty much any of the science and math prerequisites. Like my calculus was useful and the physics that I took was useful, but I took everything over again because I only had 1 semester of physics and you're supposed to have 2. So I went to school at night while I was working at the City of Cambridge, and I got all of those science prerequisites that I listed off. And it took me several years. And so I was working full-time during the day and going to school at night. But my classes were really great. I enjoyed them. They were huge because there's actually, as it turns out, hundreds of people who decide later in life that they want to be a veterinarian or a doctor. Most of the people in my classes wanted to be physicians, but it's the same prerequisites. So finally, got to go to veterinary school and let's see, what does it say on here? Oh, and part of my deciding process was doing this 1 week, I think it's called Adventures in Veterinary Medicine. And they have that program. It's an exploring camp for every level. They have it for 8th graders. They have it for high school students. They have it for college students, and they have it for adults considering changing careers. So that was me. And then finally, when I got done with veterinary school, as I said to you guys, I worked in mixed practice first. So I did a lot of dairy stuff. And then I've been working in small animal medicine and I've done various different things in small animal medicine. The acupuncture came about because, it's funny, like as a veterinarian, I was never interested in alternative medicine. When people would ask me about it, would just be like, well, I don't know, but I've got enough to learn with regular medicine, so I'm just going to focus on that. And privately, I thought, it's probably just fake and like it just maybe works because of the placebo effect and it's just kind of woo-woo. But then I had a really bad elbow pain that, I went to a bunch of different doctors for it and it wasn't getting better because it's elbow tendonitis. It's a really common problem for middle-aged people and it's not something you can fix with surgery. And I went to acupuncture for it and it helped. And I was like, oh, this is cool. And I was already doing house calls and I was already seeing a lot of older animals in house calls. And I thought, yeah, this could really fit in well because acupuncture doesn't require, obviously, a lot of equipment. You just need a few needles. That's super portable. And I figured I could do that with my patients that I was already working with. So it's a 6-month program for veterinarians. And it was at the Chi Institute of Traditional Chinese Veterinary Medicine in Florida, and they offer a bunch of courses They have an acupuncture certification. They have an herbalist certification. They've got a food therapy certification and Tuina, which is a Chinese form of massage. And they now have a master's program through that school. So it's really been expanding and expanding. And there were about 130 veterinarians in my class, and we took 3 sessions of the course were online for about 4 days, or were in person at the school for about 4 days each time, where we worked with dogs and we learned to locate points. And then 2 of the 5 sessions were online, and we just took a lot of, watched a lot of online lectures and took quizzes. I'm sure you guys are super familiar with the way that works. So I hope that answers your question about acupuncture and how I got interested in, and how I actually became a veterinary acupuncturist. I now get to put 3 more initials after my name. So I'm DVM, Doctor of Veterinary Medicine, and then I'm also CVA, which is Certified Veterinary Acupuncturist. It is very true that school does not prepare you for everything. So it's really important to get a good job, either to do an internship when you get out, or to get a good job in a place where people are excited about being a mentor for you. Because I didn't have that when I first graduated. And that's part of why I left the first job that I had, is that my boss there was a good veterinarian, but he didn't really love being a mentor. And it was very hard to get him to talk to me about my cases and about what was going on. So I think I would say that for your first job, like, really make sure to find a place that people are willing to teach you. And that's probably true of any field. I mean, rarely do you get out of some program with the need to then suddenly be the person of knowledge and authority in a life and death situation the way you do in medicine. But I think anything, you're going to get out with a certain skill set and a certain level of knowledge. And there's going to be a huge ton of stuff that you're going to need to learn to actually be good at that thing. And so having people who are good mentors is super important. So that's post-school. I think pre-school, and thinking about veterinary school and just school in general, hopefully things will be different for you guys. There's some hint that things are going to change as far as how much it costs to get an education and how stuck we are paying that back. But, the piece of advice that I would give anybody in any field is to borrow as little money as you can possibly manage to get away with, because you do not, and I did not have any idea when I went into it. Like, you're really not given a lot of guidance about how much do you actually need to borrow, and nor does anybody tell you, at least they didn't tell us, how important it is to not borrow a lot, because of course, once you have to pay it back, you're also paying interest. And so it's like a ball and chain for a long time. And it was worth it to me because I get to do something that I want to do, but I also graduated with less debt than a lot of people, because my dad was a college professor and I got to go to college for free. So when I got out of vet school, I had borrowed $80,000 to get through it. That was a lot less than a lot of people have to pay back. So yeah, don't, if there's anything that you can do to avoid or minimize borrowing money for college or for professional school, I would do it, because you do not realize until you get out how hefty it is to have to pay that back. And it affects your quality of life for a long, long, long time. Like, most people's time horizon on paying back education loans is 30 years. And it's a huge burden. I mean, basically, like, you'd rather scrimp and save and live on nothing in veterinary school, because you won't be able to do anything else anyway other than study, so you might as well have a really super low grade lifestyle and not be going out and not be spending money on having dinners out and not be taking trips, because when you get out, if you owe a bunch of money, you won't be able to take vacations or to go out for dinner. Like, you be scrimping and saving to pay back your loans. So the more scrimping and saving you do when you're actually in school, the less you're going to have to do when you get out. It's like exponential. So Yeah, I mean, it's all about fears. Like when I first started, I was really afraid that something would happen that I would have to be in charge of that I wouldn't know how to deal with, and that someone would die because I was clueless. And one of my first, and because in the clinic where I worked, we didn't have another emergency clinic to send people to, so we had to do all of our emergency work. So one of my first one was a dog that was just absolutely like, and it's gross, but it's veterinary medicine, like blowing huge, horrible, bloody diarrhea and like super shocky, super low blood volume. And I was like, oh my God, this dog is going to die. He's going to die. And I don't know what to do. I don't know what to do for him. I don't know what to do. Well, I guess I kind of know what to do. At least I know I need to put in an IV catheter and I need to get him started on IV fluids. So I'm just going to do that. Like, that's the first thing I can think of. And that's what I have to do. So I'm going to do that. And then as I was doing this, I was like, oh, yeah, I think I know what this is. I think I remember when we studied this, it's called hemorrhagic gastroenteritis. And I think he's actually going to be okay. And like it's the most miracle thing to treat because they look so bad and they're going to die, and they will die if you don't help them. But then all you have to do is give them IV fluids, and voila, like 24 hours later, they're like new and they're happy and normal and alive because of you. Like, it was actually a really good emergency to have, but oh my God, it was so scary. And I didn't go home. I like slept in the hospital. I just rolled out like some couch cushions next to his cage and just stayed there like, what's going to happen? So over time, I learned more and got more experience and became a lot less afraid that someone would die and it was my fault. Although I think that fear never really leaves you because you have to do big deal stuff. Like, unless you're not a practicing veterinarian in medicine, you have to do surgery, and that's controlled death. Like the anesthesia is like somebody's this far from dead the whole time. So you're always on alert like that, but maybe less absolutely totally like frozen with fear than I was in the beginning. And now, the things that I do are, I don't know, I have gravitated toward things that aren't particularly exciting. Like, I don't do emergency medicine. I do acupuncture, where I stick tiny needles in critters and, it usually helps, but it's not like this life and death stuff. I do life and death stuff, but it's like death stuff. Like when I euthanize animals, there's two pieces to that for me. Like, one is that it's really important that at that stage, somebody have someone compassionate that can help them, that knows what's going on. But I think one of the reasons that I've always been kind of comfortable with euthanasia is like, they're supposed to die. Like, I don't have to be afraid that I'm going to screw it up and they're going to die, because the only way that I can screw it up is if they don't die. And I know how to do it. Like, I know how to do euthanasia in a way that's comfortable, that works. Like, so that is a fear that I don't have anymore. But being bitten, like, it's always a risk. If somebody's aggressive, you have to figure out how to work with that. So that's probably the only fear that I still really have, is being bitten.
I want to say thank you so much for sharing your wisdom and your ideas with us today. And thank everyone that could come and attend. Thank you guys for spending your noon time with us today.
Yeah, thank you so much.
Right.